Good afternoon, students. Now we will see ABG analysis procedure. So, for ABG analysis procedure for taking ABG sample, um, first we have to know what is meant by ABG. So, ABG means it is arterial blood gas. So, arterial blood gas is nothing but it is an analysis which measures carbon dioxide as well as oxygen level of the blood, and also not only carbon dioxide and oxygen but also measures the pH level mainly. So these three main parameters, by measuring ABG we can able to find out oxygen, carbon dioxide and pH level. So why we are doing ABG analysis means to know the oxygen level obviously, and also to know the carbon dioxide level and acid-base balance. We have to identify. At the time we can do this ABG analysis, and also to monitor the treatment response, whether the treatment is effective or not. For checking that we can do ABG analysis. So for doing ABG analysis, there are three main common sites. They are, one is radial artery. Radial artery means at the line of your thumb. So the artery which is situated at the line of your thumb is called as radial artery, and another one is ulnar artery. So ulnar artery is the artery which is situated at the line of your little finger. So these two arteries are the main arteries which we can withdraw ABG sample. And also not only these two, the femoral artery here in the groin region, one artery is there that is called femoral artery. From here also you can take ABG sample. So for now we will take the sample from radial artery. So radial artery is the artery which we usually measure the pulse rate. Okay, so for doing ABG analysis, for taking sample for ABG analysis, patient complains about lots of pain. They are having lots of pain. That is why we should give anesthesia, subcutaneous anesthesia we should give today. So I already withdraw anesthesia from the vial, and before taking the sample we will administer anesthesia, local anesthesia subcutaneously. Now we have given local anesthesia at the region, at the site. So at least after 60 seconds we have to take the sample after giving local anesthesia. And for before taking ABG sample we have to do one test that is called Allen's test. So what is mean by Allen's test means we have to palpate, we have to press the radial artery and the ulnar artery by using both of your hands. You have to give high pressure on these two arteries, and then for few seconds, and see whether there is any change in the color of the patient's skin. It should become whitish discoloration in the patient's skin near to that area. And then after removing your hand, after removing that pressure, if the skin again turns to the normal color, that is pinkish color, normal skin color, then there is we can identify that there is blood circulation in the area. So now we already confirmed that blood circulation is there. After that only we have to take the sample. So before taking ABG sample, we have to heparinize the ABG syringe. Actually, there is a specific ABG syringe. Now it is not available, so now I'm using 2 ml syringe. So now I already heparinized the syringe. Why we should heparinize the ABG sample syringe? Because to prevent from clotting. As we all know that heparin is anticoagulant, so now we will take the sample from radial artery. So we will palpate. When you feel the pulsation at that site, at that location, you have to insert your needle. At 45 degrees. So slowly you have to insert, and if the blood comes out automatically, then you don't need to insert anymore. You can withdraw blood till 2 ml. So for ABG sample, ABG analysis, you need 2 ml blood. So you have to withdraw 2 ml blood now. You have to, after withdrawing, you have to recap and you have to press the ABG puncture side with the use of gauze paste. You have to give full pressure so that the blood can stop quickly. So with the help of your one of your colleague, you can ask him or her to press this side, and then at that time, meanwhile, you can go and check the ABG sample. And after checking the ABG sample, you can discard the needle. And after pressing few minutes, you have to check whether the blood has stopped or not. If the blood is still coming, then you have to press some more time, and then if the blood has stopped already, then you have to clean the area, and then you have to do dressing. Dressing, in a sense, you can keep a sterile gauze piece and put a adhesive tab. That's all. So this is about the ABG analysis.